Well, I think we'll start in a minute. So sorry.
Okay, I'm back.
Okay.
Think that should be better now. There we go. Sorry
Okay.
about that, everybody. Uh, nice to be here. Nice to see folks from actually different parts of the country and actually in Canada too. So, a little bit more about me. I'm calling you and speaking to you from Burlington, Vermont, in the northwest corner of the state. And as Ellen mentioned, someone from Australia. That's fun too. As Ellen mentioned, part of my clinical perspective is the Wenbing, is the school of heat. And my understanding of the Wenbing is it's seen as a minority tradition. It's seen as a tradition that's less relevant or less important than other traditions, including the Shanhunlan, the school of cold. But in my opinion, in my clinical experience, the Wenbing really can be and should be a primary school because the Wenbing school of heat assumes that disease imbalance comes from heat. And in my experience, that is very much the case. Not only are we hot individually, we're hot culturally, we're hot, and we're hot ecologically. The planet is hot ecologically. So the school of heat, the Wenbing, provides what I think is a very relevant and important perspective because as we'll talk about tonight with COVID and long COVID, both conditions have a primary component that includes inflammation. So inflammation is obviously the Western biomedical term, and heat is a very close Chinese medicine analogy for inflammation. So my understanding of heat is that heat physically is inflammation, and heat mentally and emotionally is overstimulation. So heat is very, very relevant. And I think we really should, in my opinion, individually and collectively, really consider the importance of heat and overstimulation and inflammation in the conditions that we treat. So part of my perspective and part of my clinical experience, again, is to look at the bigger view and not just to look at individual diagnoses, whether it's a Chinese diagnosis or a Western diagnosis, because how we see those diagnoses, how we make sense of those diagnoses, is based on how we see the world. And so, how we see the world really is philosophy. And so, our philosophical orientation affects fundamentally what we do in the treatment room. So, I want to start with this big macro view, and then I want to bring it down to the micro view of treating long COVID. And this bigger macro view is really, really important. It's not secondary. It's not just, well, okay, philosophy is nice and Chinese philosophy is nice and Asian philosophy is nice, but let's get down to the important stuff. What's acupuncture and herbs and nutrition and formulas to treat long COVID? My view is that the bigger view is what informs the smaller view. And so I really look on medicine as the clinical application of philosophy. That medicine is the clinical application of how we see the world. And part of that larger view, that larger philosophical view, is the language that we use. And the language that we use is very, very important, not only in our lives, but in the treatment room. And so, what I want to do tonight is translate some Western biomedical terms, including COVID and long COVID, into Chinese medicine. Because once that happens, then it's, again, my opinion and my clinical experience that we can treat it. If we just keep the language of Western medicine, whatever conditions we're treating, as Ellen mentioned, I treat a lot of people with COVID and long COVID and Lyme disease and psycho-emotional conditions and neurological conditions. All of those Western diagnoses are fine. But if we can translate those Western diagnoses into Chinese medicine diagnoses, then it provides us, in my opinion, again, a very clear framework to understand what's going on and how to treat it. And another important view, and by the way, I'm talking from an outline that was provided. And so if you have that outline, you'll be going through it. If you don't have the outline, you can get access to it after the class. So another really important point, fundamental point in my opinion, is the idea of, should we standardize the treatments that we administer, or should we customize? Again, can seem like a simple issue, but for me, it's a fundamental issue. It's a root issue for how we treat as Chinese medicine practitioners. So the emphasis, the very, very strong emphasis in Western medicine and Western biological medicine is to standardize treatments, right? Is to say, okay, we have a diagnosis, whatever it is, let's say COVID or long COVID. What is the protocol that we're going to use to treat it? Or what's the one formula, or what's the one herb? That is a philosophical orientation. To say that we want to standardize, we have this diagnosis, whether it's Eastern or Western, and we're going to do this one thing, is making assumptions about the world. And in my opinion, those assumptions are not the best clinical assumptions. Because as I'm going to be talking about tonight, I'm going to be teaching from an article that I had published in the Journal of Integrative Medicine in April of this year, April of 2025. And it's titled Long COVID Response to Classical Chinese Medicine. And I co-authored it with two medical doctors that I've been working with from Dartmouth-Hitchcock Medical Center here in the Northeast of the United States. So in that article, I and we, my co-authors and I, really emphasize the need to treat the individual first and the diagnosis second. And that's really important because with something like long COVID, according to the CDC, the Centers for Disease Control website here in the United States, there are over 200 signs and symptoms associated with long COVID. So the idea that one remedy, oh, what's the name of the article again? It's called Long COVID Response to Classical Chinese Medicine. And it's available on the NIH website if you have access to that. If you go to my clinic website, which is Jade MT Wellness, just Jade MT Wellness, which stands for Jade Mountain Wellness, jademtwellness.com, and you go to the home page, the first page on the site, and you go to the top, to the header, there's a link to the article there. So what I wrote about in the article, what we wrote about in the article, is the need to customize treatments, the need to treat the person first and the condition, the diagnosis second. Because in my mind, there's no way that one remedy, whether it's a pharmaceutical remedy, an acupuncture protocol, an herbal protocol, whatever it is, whatever modality we're using, there's no way that one remedy is going to successfully treat 200 signs and symptoms. It makes no sense. But if you're standardizing treatments, one way to make sense of that is we just become not very ambitious. We say, okay, we took this pharmaceutical, or we have these 5 or 10 points to treat long COVID, or we have this one herb formula, and it helps some of the people some of the time. And we say, well, that's good enough. Okay, that's fine. But as the article talks about, and as the case study I hope I have time to go over tonight indicates, we can be much more ambitious than that. You know, a goal can not only be to treat all the signs and symptoms of long COVID, but it's possible for people to feel better after treatments than before they got COVID or long COVID. And that's not pie in the sky thinking. That's not just something that we can aspire to alone. That is really achievable. And one of the case studies from the article that I write about, a woman said exactly that. You know, she said, and she was having a hard time. She had a lot of signs and symptoms. She said, unsolicited, just told me that I feel better now than before I had COVID, let alone before I had long COVID. So if we're aspiring to really help people, if we're aspiring to do more than just alleviate some symptoms, or to use a Western biomedical term, if we're trying to do more than just manage symptoms, if we want resolution of symptoms, then I think it's imperative that we treat the person rather than the symptoms. And historically, in what I'll call classical Chinese medicine, that was the emphasis. We were trying to treat the person. And that is not only a nice idea, but it's also very, very effective clinically. So an important way to customize treatments is to understand where something comes from. We're not just trying to treat COVID, and we're not just trying to treat long COVID. We're trying to understand the nature of COVID and the nature of long COVID. And again, in my opinion, the older aspects of Chinese medicine, the historical aspects of Chinese medicine, the traditions of Chinese medicine allow for this. They allow us to understand the nature of a condition. And once we understand the nature of a condition, then hopefully we can match the nature of that condition to the tradition of Chinese medicine that will treat it most effectively. Okay, so how do we begin to understand long COVID? Well, one way to understand long COVID is to understand the nature of COVID, because long COVID comes from COVID. So in order to understand long COVID, we have to understand where it comes from. So that's the idea of the root and the branch. The branch are the symptoms and the root is where the symptom is coming from. So part of the root of long COVID, of course, is COVID, because that's where long COVID originally comes from. So one way to make sense of it is just to look at the signs and symptoms of COVID. So not only from an Eastern view, but from a Western biomedical view here in the United States. Part of what's understood is that COVID can start with chills, and then it can start with chills and fever. So what does that indicate? Well, that clearly indicates to me that COVID starts with cold, because the V, COVID, the V part of COVID is virus. And viruses, by their nature, are usually, not always in my experience, but usually cold. And how do we know that? Because some of the first signs and symptoms are people feeling chilled. So what is chilled? Chill is cold. So what tradition can we go to start to understand this? We can go to the Shan Han Lun, which specializes in cold. And so the first stage of cold, it will call obviously Taiyang, the initial stage. So stage 1 is cold, Taiyang. And then the second stage is Xiaoyang. Xiaoyang is alternating chills and fever. So first stage cold, second stage alternating chills and fever. So again, if we hear that part of a symptomatology includes alternating chills and fever, again, we know the tradition to look to, because that's the Shan Han Lun. Shan Han Lun, the second stage is Xiaoyang. To compare and contrast a bacterial infection, not a viral infection now, a bacterial infection starts usually with heat. And how do we know that? Because a bacterial infection usually, or in my experience, I've never seen a bacterial infection start with chills. It just starts with heat. It just starts with heat and fever. So if something starts with heat and fever and doesn't have chills, what is that? Well, that's very, very likely to be heat. So is that the same thing? It is not the same thing. So what's the tradition that specializes in heat? The School of Heat, Wenbing, right? So again, to really try to match the condition with the tradition in Chinese medicine, because not all traditions are going to treat every condition with equal efficacy. So let's take a bacterial infection. Again, COVID is not bacterial. I'm just taking this as an example. If we have a bacterial infection and we assume it comes from cold and we apply the Shan Han Lun principles, is that going to work well? No, it's not going to work well, because the Shan Han Lun assumes things come from cold. So at the beginning stages of treatment with acupuncture and herbs, they're warming things up. They're warming the body to create diaphoresis, to create sweating, to vent out the cold. So if we say, well, we're going to do that with a bacterial infection, that does not make sense. That's not a coherent strategy, in my opinion. Again, because different conditions are different, and different traditions in Chinese medicine have different assumptions about what's going on. So I think it's very important clinically to match the condition with the tradition. And there are different traditions. They're not all the same. A bacterial infection is not the same as a viral infection. The nature is different. Viruses are usually cold. Bacteria is usually heat. That's not the same thing. Heat and cold are not the same thing. The treatment principles are not the same. The acupuncture points, the diet and lifestyle recommendations, the herbs, it's not the same. The overriding principle is the same of healing people, but the way that happens is different, because one condition is hot and one condition is cold. And on top of page 2 now, if you have the outline, another really important point is Zong Fu diagnosis is only part of the picture. It is not all of the picture. This is really important because I speak to Chinese practitioners and actually Western practitioners too about long COVID. I get a lot of referrals from Western practitioners in Western hospitals here in New England about long COVID. And looking at a Chinese medicine perspective on it, a lot of what I see people doing is they're just using the Zong Fu diagnosis and they're treating that. But that's not enough, because if someone comes in with long COVID, for example, and they're tired, so let's just call that, use Chinese medical terms, we'll call that they're qi and yang deficient, or because they're qi deficient, they're blood deficient. And then people say, well, they're tired, so we want to tonify qi and yang, or we want to tonify qi and blood. That's, in my view, that's probably not going to work, because the Zong Fu diagnosis is only telling us what's happening in the present moment. It's the general time frame of the present moment. What Zong Fu diagnosis does not tell us is where something came from or where something is going. Zong Fu is the present moment. And to understand where something came from and where something is going, that's where we need the traditions. Because the traditions, for example, I've been talking about the Shanhan Lun, School of Cold, and the Wenbing, the School of Heat. Part of what they are is disease progression theories. You know, with Shanhan Lun, School of Cold is saying Tai Yang to Xiao Yang to Yang Ming to Tai Yin, right? So it's describing the movement of cold. The Wenbing, the School of Heat, is saying things start at the Wei level and they go to the Qi level, the Qing level, and then the Shui, the blood level. So it's talking about this progression. Zong Fu is only the present moment. It doesn't have a clear understanding necessarily of where something came from or where something is going. So a good saying for that, a good axiom for that in Chinese medicine is that the superior physician understands transmission. So how do we understand transmission? We understand transmission by having lineages behind what we're doing. In other words, to have an understanding of the different traditions and schools of Chinese medicine. And if we don't want to understand, sometimes in modern thinking, we don't like the term superior or even or physician. So let's just say the insightful practitioner understands transmission, right? And so Zong Fu is the present, but the present is connected to the past. So let's say I was talking before about Xiaoyang, second stage of wind cold. Where did Xiaoyang come from? Xiaoyang comes from Taiyang, which is the first stage. So Taiyang leads to the second stage, Xiaoyang. What comes after Xiaoyang? After Xiaoyang is Yangming. What's after Yangming? Taiyin, right? So depending on where the signs and symptoms that a patient is experiencing and the pulse and tongue associated with those signs and symptoms, we can know where something is. And where something is, how we treat that can be treating what came before it, but also in a truly preventative manner, we're trying to prevent something from progressing, right? So when we're treating the future, let's say something is at Xiaoyang, second stage of wind cold. Part of what we can be doing and anticipating is trying to not have it go to Yangming, or not have it go to the internal stage, start to go to the internal stages like Taiyin. And so what we're trying to do, and this is very achievable, this is not like pie in the sky, possible but not really possible stuff, is we're really trying to treat the past, the present, and the future simultaneously. And that's very possible to do. The disease progression theories and the traditions that we have in Chinese medicine map that out. Want to treat where something came from, where something is, and where something is going. And again, when we're treating where something is going, we're preventing things from progressing. So the traditions allow us to do that, and Zong Fu is only part of that picture. And honestly, in many cases, in my opinion, it's not even the most important part of the picture. So if someone comes in with long COVID symptomatology and they are tired and they're qi and blood deficient, or maybe even they're yang deficient, does that mean that's all that we treat? No, it doesn't mean that's what we treat predominantly. Because even when people are tired with something like long COVID, or I treat a lot of people with Lyme disease, what I'm trying to do is clear things out predominantly. I'm trying to clear out the viral or bacterial infection that's causing a problem. So I'm not tonifying a lot. And if we just rely on Zongfu diagnosis, that, in my view, doesn't give us the understanding of where the symptomatology is coming from. Okay, so middle of page 2. What are our assumptions individually and collectively about COVID and long COVID? Do we have to just rely on Western research? Do we need Western confirmation to treat COVID and long COVID? And what about if conventional medicine, Western biomedical medicine, doesn't understand the condition or they don't know how to treat it? Well, I'll answer all those questions. Do we have to rely on Western research? No, we certainly do not. Especially with something like long COVID, because I'm working with Dartmouth Hitchcock Medical Center, and I have been working with them for several years, and they've been referring patients to the clinic, and those patients have been getting better. So with long COVID and with something like Lyme disease also, Western research doesn't have a clear understanding of it. So if we're just relying on Western medicine to understand something like this, we're not going to get very far with that. And truthfully, we don't have to rely on that, because Chinese medicine has a clear understanding, in my view, of what's going on. Do we need Western confirmation of what we do is successful in treating COVID or long COVID? No, we do not. We just have to translate the Western symptomatology into Chinese medicine, and then we can treat it. And what if Western medicine doesn't know how to treat it? Are we stuck? We are not stuck. In going back and looking at case studies for this article that I wrote, I was treating what became labeled as long COVID in June of 2020. So that was a couple of months. I was basically a season after long COVID really hit, COVID really hit here in the US, and I assume in other places where people are around the world. So I was treating it, and I was consistently seeing very, very good results, and there wasn't even a term for it. So I wasn't waiting for a Western biomedical term to treat it, because I was confident that it could be treated. So I frame it that way because I think we can become overly reliant on Western medicine. Chinese medicine is a comprehensive medical system. Chinese medicine can treat basically anything. And COVID and long COVID are examples of that, right? And as I'm going to talk about next, Western biomedicine does not have a clear understanding of it, and it's not proposing any treatments that I think are even coherent. The two major, not exclusive, but two major ideas on how to treat long COVID is with the use of Prozac, an SSRI, antidepressant, and with nicotine patches. So COVID and long COVID are inherently inflammatory conditions, both from an Eastern view and a Western view. And Prozac is warming. So using a warming remedy exclusively to treat a warm condition does not make sense, in my opinion. So Prozac doesn't make much sense. And then nicotine patches. Nicotine is, not only is it hot, it's addictive. So we're going to try to treat a potentially debilitating condition with an addictive substance? That makes no sense at all. So I think long COVID is an example where I don't think we're going to find much if we rely or over rely on Western medicine. So part of the bigger picture I want to talk about tonight are the economic issues of long COVID, as well as the healthcare policy issues with long COVID. And I think that that's relevant because I really believe, especially in talking with lots of Western medical folks who are policy folks and economics folks and docs, they know there is a tsunami coming in the United States, and I believe people know it around the world too. And that tsunami is just part of it is just numbers. It's just staggering. So here in the United States, in one country in the world, it's estimated that about 20 million people, we have about 350 million people in the United States, 20 million of them, or over 5% of the population of the entire country, currently has long COVID. That is staggering. And of those 20 million people, 3 to 4 million people, just in the United States, not globally, just in the United States, 3 to 4 million people could apply for permanent disability. Here in Vermont, the little great state of Vermont, here in the Northeast of the United States, we're one of the smallest states in the country. 30,000 people in Vermont, 30,000 Vermonters currently have long COVID. Staggering, staggering number. And healthcare is much more than economics, but just to provide a context for it, the current estimate in the United States is that lost wages yearly, not total, yearly, lost wages in the United States from long COVID, 170 to 200 billion dollars a year. That's over 1% of the gross domestic product. That's over losing 1% of all the money that is made in the United States every year is just gone because people can't work. Really staggering numbers. And as I mentioned before, according to the CDC, here in the United States, there's over 200 signs and symptoms associated with long COVID. And the good news about all that is that we can treat it. We, as Chinese medicine practitioners, can treat it. As I mentioned before, I don't think Prozac or nicotine patches make sense. I don't think that any one remedy of any kind is really capable of treating over 200 signs and symptoms. And part of what I think those numbers mean in the United States is long COVID could absolutely overwhelm the system, truly. And policy people know that, and healthcare economic people know that. And so they're investing a lot of money in trying to understand how to treat long COVID. But my experience is that we already know how to treat long COVID. We don't have to create something new. We can look to what is old. So rather than having a yang focus, looking for what is new, we can have a yin focus and look at how these similar conditions have been treated historically.
I have a question for you if you're ready for one.
Yeah. Mhm.
What are your thoughts on some of the OTC supplements recommended, including NAC, quercetin, green tea, vitamin D, vitamin C, for treatment of uh, COVID and long-term COVID?
I think effective remedies need to be customized. I think there isn't any over-the-counter supplements that are going to be effective, truly effective. And that's not a criticism of over-the-counter supplements. It just means they're not customized. And so in looking at them, quercetin can be cooling, green tea is cooling, vitamin D is hot, and I think it tonifies kidney yang. Vitamin C is cold. I have not seen any case studies that indicate that those things can be truly effective. So the good part about what I'm talking about is that it really can be effective, truly. I've treated close to 60 people with long COVID at this point, and people have really gotten better. People who were partially or even completely disabled have gotten better. So that's a good part. The bad part is I'm talking about really customizing things. So with long COVID, I would, and anything like Lyme disease, late stage neurological Lyme, I'm not recommending anything that's not customized. I mean, diet and lifestyle, diet doesn't have to be so specific, but any supplement or any herb formula, I'm recommending that it be customized because it has to be specific to the person. And if you're pulling anything off the shelf, whether it's a over-the-counter supplement or even an herb formula, if it's pre-made, it can't be customized. So I'm not recommending any of them. Okay. And now I'm not saying that any of those substances can't be effective. They could be effective, but they'd have to be used in the context of customizing to the person. Okay. So to understand long COVID, we need to understand COVID. And one way to, I think, be honest about that is rather than saying we're treating COVID or long COVID, Western medicine can be territorial about that. So the way I treat COVID is by not treating COVID. I treat COVID by treating the nature of COVID. And I treated hundreds of people with COVID. Really, the clinic here, we shut down for about 5 weeks right after COVID hit. And then the rest of the time I was practicing full time. And I was filling a lot of herb formulas and talking to people on the phone and eventually doing treatments. So I treated, I don't know, hundreds of people with COVID. And I did not say I was treating COVID. I said I was not treating COVID. I was treating a Chinese medicine understanding of a viral infection. And similar with long COVID. Do I treat long COVID? I do not, because long COVID is a Western biomedical view. But what I can say confidently is we can collectively have a clear understanding of COVID, and we can treat that. Just another quick question. Collagen peptides, long posted, recovered. Yeah, peptides I would say, are stimulating, and so it can help with the qi. So qi, we can think that perhaps there was qi deficiency there. What about incorporating LDN on top of TCM? I don't know what LDN is. So, and my bias, my orientation is Chinese medicine. So I don't think we need to look outside of Chinese medicine to treat anything. Low dose methotrexate. Yeah, methotrexate. That's really strong stuff. I don't think that's necessary. And my orientation is Chinese medicine. I believe I've been trained and I've seen clinically that Chinese medicine is a comprehensive set of medical traditions plural. There's not just one. So I don't look outside of that. I don't look to supplementations. I don't look to vitamins. I don't look to Western medicine. I just look to Chinese medicine. So to understand COVID is a way to understand long COVID. They're cold. It starts with cold, but the cold can transform into heat. Again, to understand the nature of it, we just go back to the signs and symptoms, the symptomatology. COVID starts with cold, and then it transforms into heat. So then we know, because COVID creates long COVID, that the nature in the beginning of long COVID was a cold condition. And so what is cold? Cold is Shanhanlun. And an important part of treating cold is the context of treating cold. So we live in a hot world. The planet is warming. Here in the United States, we are particularly hot. We're particularly inflamed. We're particularly overstimulated. So then I believe we need to understand that COVID as a cold condition is affecting us, and we're hot internally. So that's really important, because once we say we're hot internally, then that means we're outside of the realm of Shanhanlun, in my view. We're in the realm of the Wenbing, the school of heat. So that's important because, again, the idea of an insightful practitioner or a superior physician, right? We want to, if we're treating something like a cold condition, like a virus, like COVID, it's important to understand what the internal condition is at the same time. So it's not just enough, in my view, to treat wind cold. We have to understand the nature of what's inside. So we can treat the external and the internal simultaneously. And the primary condition I treat clinically is heat. So with formulas, we can talk about having formulas that treat the different external yang stages of wind cold, while also treating internal heat as well. And the Wenbing is really important because the Wenbing was developed to treat epidemics. The Wenbing was really developed starting in the 1300s in China. And my translation for that, it was developed because the Shanhanlun school of cold was not effective at treating epidemics. And part of the reason for that is that epidemics are hot conditions. Things that move quickly and broadly implies excess yang, and excess yang is heat. So the Wenbing is the epidemics tradition. So even though COVID starts with a virus which is cold, the Wenbing, I think, is crucial to understanding the practicality of treating epidemics, but also the bigger view of where epidemics come from. So this requires a blending and integration of the Shanhanlun, the school of cold, and the Wenbing, the school of heat. So that integration provides more clarity on how to treat what we need to treat. And the Wenbing has some, not surprisingly, some very insightful things to say about epidemics. One of the fundamental things it says is that epidemics obviously is a collective condition. Epidemics is not one person getting sick. It's a lot of people in a large area getting sick. And the Wenbing speaks to the question of, well, why do people get sick? Why do so many people get sick? So many people get sick because so many people are out of balance. So many people are not well. So in the United States with COVID, and there's discussion about this and the accuracy of this, but I think it's relevant. The United States is 5% of the global population, but we had 20% of the global diagnoses of COVID. Now, some people will say, well, because we had better testing, but that's not the totality of it. Because European countries had good testing, Asian countries had good testing, Eastern European countries had good testing. So it wasn't just that we had better testing. I think the fact that our infection rate was 4 times what our population was globally indicates that we're not a healthy people. And so the Wenbing speaks to that. Epidemics happen because large groups of people are out of balance. Another way of saying that, epidemics happen when the culture is out of balance. So in order to learn the lessons that I think are vital to learn about COVID and long COVID, that is essential. We're not going to prevent the next epidemic unless we address those larger issues. And those larger issues really speak to how we live, what we value, what we don't value, what's important, what's not important. And if you're interested in that, I wrote a book about that, and it discusses a Chinese medicine view of climate change. And so climate change is very relevant to what I practice in general and with long COVID, because climate change externally, the warming of the climate, is a reflection of what's happening internally. So if we really want to understand how to treat our patients, I think it's essential to look at the fundamental imbalances in our countries and in our culture and in the world. So I wrote a book that you can look at if you want more references to that. And as a reference point, what's the title of your book? The title of the book is called The Yin and Yang of Climate Crisis. And it was published by North Atlantic Books here in the United States, and it's gotten a good distribution. So yeah, climate crisis. So it's got distribution. It's all over the world. It's in Amazon and Barnes and Noble and other bookseller places too. So just for a context, how hot it has become. And there's lots of examples of that. But in 2022, in India, in a populated part of India, in 2022, 3 years ago, it was 143 degrees. That's not livable. That's not livable. And that's not an outlier. The planet is warming, and the planet is warming because the cultures that we live in are warming, and that overheated country and culture and planet is a direct reflection of the heat that we have on the inside. Here in Vermont, in June of 2022 and 2023, we really had back-to-back devastating floods, and there's floods all over. I teach in Florida. There were floods in Florida. I teach in North Carolina, and I study in North Carolina. There were devastating floods there. So it's not an isolated thing. It's not just happening in the United States. It's happening all over. So to understand long COVID also, there's another tradition. So I talked about Shanhan because the nature of viruses is cold. Nature of COVID is cold. So the Shanhan is very important. I talked about how hot we are, how hot our country is, how hot the culture is, how hot the planet is, and how the Wenbing tradition is a tradition of heat, but it's also the tradition of epidemics. So we have to understand that. We have to understand both of those traditions. Another really important tradition is the neurology tradition. And the neurology tradition is the Wai Ke. And that's relevant because early on I saw this clinically, and Western medicine has seen it, and Western medicine talks about it, is that there is late stage long COVID, folks can develop neurological symptoms. And that is very true. And I saw that starting in June of 2020. I was starting to see people with long COVID who were developing neurological conditions. So again, matching the tradition to the condition, the Wai Ke, the neurological tradition, is the tradition to treat neurological symptoms. And the Wai Ke emphasizes wind. So neurological conditions of all kind, migraines, tremors, twitches, seizures, Tourette's, all of that is wind. And all of those things can be scary, but they're only scary if you don't know how to treat them. I've treated lots of people with every kind of seizure, grand mal seizures, epileptic seizures, febrile seizures, childhood seizures. I've treated all of them successfully. And that's because the place to start is wind. So the Waika, the neurological tradition, is also very, very important to incorporate. And then there's another view that is really relevant as well with for long COVID and Lyme and late stage neurological Lyme, those kinds of multi-organ, multi-system, multi-symptom conditions. And that's the disease progression theory called Bien Hua. And the translation of Bien Hua is to change and transform. And very, very relevant and one of the most important understandings that I apply clinically in general, but also with long COVID in particular. So with Bien Hua, there's 4 stages, and it's really interesting. The stages are really interesting because it speaks to the diversity of views and the diversity of opinions and the diversity of clinical thought processes in Chinese medicine. So the first part of Bien Hua is heat. So as soon as we say something is heat, we have another view to go to, which is the school of heat, which is the Wenbing. So this tradition, Bien Hua, I would say, is very much a Wenbing oriented tradition because it's saying the first part of this is heat. Okay. Bien Hua is B-I-A-N, thank you for asking, B-I-A-N-H-U-A, Bien Hua. And I learned about Bien Hua from my teacher, Jeffrey Yuen. I have not seen it in writing anywhere. I actually have written articles about it and I teach about it, but I have not seen it in writing. It could be part of the tradition in Chinese medicine that's oral, that I orally transmitted generationally. So I haven't seen anything in writing about it, but it's Bien, B-I-A-N, Hua, H-U-A. So to change and transform starts with heat. So that's a Wenbing view in my opinion. So 4 stages. First is heat. Heat creates dryness. That's simple, right? That's basic kind of Chinese medicine stuff. The heat goes up, the yang goes up, and the yin goes down. So heat creates dryness. But the third and the 4th stage is where it gets interesting. So first stage is heat, second stage is dryness. With the dryness, second stage goes to the 3rd stage, which is phlegm, which is dampness. And the thinking about this is that with the heat creates dryness, dryness is a lack of fluids. With a lack of fluids, the body can create or hold on to whatever fluids it can get. And the fluids that won't be burned off or cooked off are sticky fluids or heavy fluids. So the lack of yin, of dryness, creates an excess of yin, which is dampness. So this is interesting. This is important because a lot of times we think yin and yang is oppositional. Like yang goes up, yin goes down. If yin goes up, yang goes down. This is saying when the yin goes down with dryness, a lack of yin, as a response, the yin can go up, which is dampness, because dampness is an excess of yin. So heat in excess of yang creates a lack of yin, which is dryness. The lack of yin creates an excess of yin, which is dampness. What's the nature of dampness? Dampness is heavy and weighting things down and lethargy and affecting the earth phase, the stomach and the spleen, affecting digestion. So it's a sense of heaviness. Yeah, pathogenic yin. Yeah, pathogenic or turbid yin or out of balance yin. Yeah, so a lack of yin can create pathological yin. And the nature of pathological yin is it's heavy and weighting us down. So as a response to an excess of yin, the body generates the force within us that can create change, that can blow away the yin, the excess yin, which is wind, internal wind. So really interesting. Heat creates dryness, lack of yin. The lack of yin creates pathological yin, which is dampness, which is heavy. From the heaviness, the body generates the movement to try to get rid of the heaviness, which is internal wind. So this can explain how an inflammatory condition like long COVID can create neurological symptoms. And I had, before COVID came around, I had been applying Bien Hua for more than a decade to treating Lyme disease and late stage neurological Lyme with really, really excellent results. So the first stage is heat, right? But COVID, the first stage of COVID is not heat, it's cold. So we have to just put a little parentheses. We say cold, COVID transforms into heat, which creates dryness, which creates damp, which creates wind. So once we do that, we really can understand how cold of COVID can go through the stages and create neurological conditions. And they include tremors, twitches, seizures, migraines. So we have a way to understand that. We have a way to make sense of that. So to kind of bookend that, we're saying the first part of this is heat, which is the school of heat, which is the Wenbing, and the last part of it is wind, which is Waike. So we have an understanding about how heat can create wind. And there's lots of different ways of thinking about it. And then the question is, well, what do you treat first? What do you treat second? My answer to that is it depends. But getting rid of the heat, which is where it's starting, is important. And I'm very much not exclusively, but I use a lot of Wenbing theory. So I'm emphasizing getting rid of the heat. So to put all that together, my view, my clinical experience is that a synthesis of these perspectives provides us with a clear understanding of what's going on. So a synthesis of the Shunhan school of cold, again, because viruses are cold, with the Wenbing, because the cold transforms into heat and we are so hot internally. And the epidemic view is the Wenbing, and we're treating an epidemic. There's an epidemic of COVID, and now there's an epidemic of long COVID. So the epidemic tradition is the Wenbing. But then we also, this disease progression theory is essential, Bien Hua. And the last part of Bien Hua is wind, which is the neurological tradition, which is Waike. So putting all of that together, synthesizing that is a way to clearly understand how to treat long COVID. And so again, not every tradition is going to do that equally well. If we're just assuming that people are deficient and cold, Shanhan, that's not enough. If we're just taking the epidemics tradition, the Wenbing, that's not enough either, because this all starts with cold. And if we're using the Wenbing or the Shanhan and we're not using the Waike, then how do we explain the development of wind with, let's say, late stage long COVID? And then if we're not doing Bien Hua, tracking how the heat becomes the wind, then we're missing out on that. So putting all of this together is a very effective, clear way of understanding and treating COVID and long COVID. And so hopefully with that understanding, it can become clear why I don't think it's possible to use one thing, one formula, one protocol, one supplement, one herb formula to treat all this. It's just not going to work. And I am ambitious in how I treat. I'm not just looking for the resolution of some symptoms, I'm looking for the resolution of all symptoms. And I'm looking for people to feel better after treatment than even before they had COVID, let alone before they had long COVID. So if we have those kind of ambitious goals, customizing is really important. Okay, just so some questions up here. Yeah, someone mentioned about the standard American diet. Yeah, not good. Doesn't promote health. It promotes something other than health. Questions, if you notice fine but deep cracks that have more common people tongue, especially in the upper mouth. With COVID, maybe just where the cracks are. Yeah, I would say it depends. It depends on the person. The cracks can be in different places. Yin deficiency in Australia. Yeah, in the United States too. Lots of heat and yin deficiency. Oh yeah, the posting. So if this discussion is relevant, there's going to be another class Saturday, September 20th. That's going to be live, and we'll go into more details. And I'd love to continue the conversation with who's ever interested then. And there's a 10% discount. You can use the code. You can go again to the FASOMA website, the Florida Acupuncture Association website, and use the code long COVID 10, and that'll save you 10%. Yes, and do I teach a full class on treating COVID, long COVID effectively? Yep, that's what September 20th is about. We'll have more time, and I'll go not only into the theory, but I'll go into very specific case studies. I'm going to go through a whole case study of someone I treated who was having a really, goes back to September of 2020. This is one of the earlier people I was treating, and she was having a hard time, and she's not having a hard time now at all. Okay, let's see. Is there a way to contact you if there's more questions? I think a good way to contact would be through Net of Knowledge. FSOMA's sponsoring this, but Net of Knowledge is also sponsoring it. So maybe we can continue the conversation there. I haven't spoken to Net of Knowledge about that, but they're a wonderful organization and they seem to promote communication between practitioners. So if we wanted to have a conversation, we can see if that can continue through Net of Knowledge. I think that would be a good way to do it. Can you get a copy of the outline? Yes, I think FSOMA or Net of Knowledge can help with that. And if you want some detailed information too, again, the article I co-authored will provide some of that. Okay, so we have these nice theories, and I just want to finish with a case study. And then I'm happy to continue with questions, but I just want to let you know that these theories are not just abstract theories. Like where the rubber meets the road, these theories can be very, very effective. So this is case study 2. I'm just going to go through it briefly. Case study 2 from the article I co-authored. A 73-year-old woman tested positive for COVID, confirmed long COVID diagnoses, began treating. And what happened with her is she had, for over 30 years, she had a confirmed Lyme diagnosis. She also had COPD, chronic obstructive pulmonary disease, which affected respiration. And she got COVID, and she then developed long COVID, which was diagnosed by a Western doctor. And then a week after she came in for treatment, she got COVID again. So she had a lot of stuff that was layered on. So with the new symptoms that appeared with COVID, she developed poor balance, feeling chilled when tired, which suggests that she had cold from the COVID. She described a racing mind throughout the day, poor sleep, only 2 to 3 hours a night, brain fog that prevented her from thinking clearly and recalling words and events. And then symptoms that were exacerbated was an increase in headaches. This was very significant. When she came in, she reported that the pain in her head was 7.5 to 10 at least, and was up to a 10 out of 10. So she had constant 24/7 pain. She also said that before the initial appointment, the pain was, quote, direct quote, constant 24/7. Again, direct quote, at worst, I feel like there's a rod going through my temples. And at best, it feels like my temples are in a vice. Another direct quote about the pain in the temples is around the lower back of the head, so the occiput, and there's wind points here. So this pain often suggests wind. There's also pain behind the eyes, which suggests internal wind, and she's very tired. And she said the constant headache was pushing me to the limits. And she said her back pain and muscle pain had gotten worse since COVID, increase in fatigue. Direct quote, since COVID, I'm exhausted all the time and short of breath. I can push myself to do 2 or 3 small tasks a day, and I need to lie down. COVID exhaustion is really challenging me. Also reported increase of chest tightness and short of breath. Pre-COVID diagnoses, Lyme going back to 1992, COPD diagnosis, and she also got exposed to COVID before a week after starting, so she got COVID again. And with the recurrence of COVID, she had pain everywhere. Pulse and tongue indicated a lot of heat and a lot of damp. In particular, there was heat and dampness in lung, large intestine, spleen, stomach, heart, small intestine, liver, gallbladder. Basically heat and wind everywhere. Excuse me, heat and damp everywhere. She also had a lot of internal wind in the liver and the gallbladder. The treatment was 23 treatments over 4 months. So that was a lot. It was about, let's see, 1.5 treatments a week. And she started to see really good results. And part of the good results, in my view, diet and lifestyle is essential. Acupuncture herbs, 50% of the efficacy. Diet and lifestyle, another 50% of the efficacy. So diet and lifestyle, she eliminated coffee. I have a whole chapter in my book on climate change about coffee. I think coffee is inherently pathological. I don't think there's really any benefit to coffee. And I know some of us acupuncturists don't like that, but that's the truth as I understand it. And if you want more information on that, you can read, I think it's chapter 4 in my book. Because coffee creates heat and damp, eliminated all dairy because dairy can create damp, increased animal protein, but no chicken and turkey because chicken and turkey can contribute to both heat and wind. Eating lots of root vegetables because root vegetables are rooting. Eliminated all spicy food, all onions, garlic, cayenne, turmeric, ginger, etc. But wait a second, all those are good for us. They're good for us if we have cold. They're good for us if we're taking a Shen Han Lun view. But my view is not a Shen Han Lun view. My view is a Wenbing view. So this is, again, important. Not all traditions match conditions. So with something like long COVID and Lyme disease and late-stage neurological Lyme, it's really important to not introduce heat to the body. Eliminated avocados because they're damp, eliminating alcohol because alcohol is warming and damp. Increased rest and decreased activity, increased time in bed, emphasize cooked foods, limiting raw foods, and increasing root vegetables, as I mentioned, potatoes, carrots, beets. Lots of points to clear heat, like stomach 40, stomach 41, large intestine 11, large intestine 5, lung 7, liver 2. Points to tonify yin, kidney 10 is the water point on the kidney, which tonifies kidney yin. Heart 3, the water point on the heart, increases heart yin. Liver 8, the water point on the liver, increases liver yin and liver blood. Did some points to tonify some blood, liver 8, moved blood, the G clef points to move blood. Moved chi, lung 6, the G clef point on the lung, large intestine 7, the G clef point on the large intestine. Little bit of tonifying qi and yang, but not that much. So she was totally exhausted, totally exhausted. Did I tonify a lot of qi and yang in the beginning? I did not. It was clear, 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 clear. Shen Han Lun view assumes that people are cold and deficient. My assumption as a Wenbing practitioner is people are excess. So if in doubt, I clear stuff out, right? I disperse. And from a Shen Han Lun view, that may not make sense, but from a Wenbing view, it does make sense. So if you have things like COVID, long COVID, Lyme disease, late stage neurological Lyme, clear things out. With COVID and long COVID, clear out the lingering effects of the virus. More important than tonifying. Get rid of the stuff that is not helpful before you try to bring in the stuff that is helpful. Points I've mentioned in the article, points to clear heat, stagnation. I use a lot of strong older treatments like internal dragon treatments and external dragon treatments that was brought to the West by J.R. Worsley in the 5-element tradition. And I also use ghost points from people, including Sun Sin Yao's ghost points. They're really profoundly effective. Those kinds of treatments are literally where someone's life is going in one direction and now it's going in a different direction. It's going in a positive direction. So those points can be very important. Herb formulas, when she got COVID again, was Jiaoqing Long Tong, minor blue-green dragon, because it was going to the second stage, Xiaoyang stage, alternating chills and fever. After that was resolved, then formula I use a lot for heat and dryness and damp is Bai Hu Tong, which is a very effective formula. For clearing heat in the blood and tonifying yin in blood, Heavenly Emperor Tianwan Bushen Dong is very effective. And then as a strong bronchial dilator, using a Western herb called lobelia, which is Lobelia inflata, which is a strong bronchial dilator, but it's cooling. So inhaled bronchial dilators can open the lungs, but they're very warming. So if you have a condition that's inflammatory, adding a warm bronchial dilator is not likely to be curative. Lobelia inflata, a Western herb, as a tincture, is effective. So how did all this work? How did the application of the theory work? Well, by the third week of treatments, the patient reports that her head pain, which had been at least 7.5 out of 10 to 10 out of 10, 3 weeks, was 0 to 1 out of 10. And a couple of weeks later, it went down to 0, and it stayed at 0. Currently, when I wrote the article, there was no head pain at all and no migraines, 0 out of 10. Patient reports feeling less fatigued and able to be more active at home. The racing mind has decreased, less brain fog. The shortness of breath had maintained because there was a lot of the COPD creates a lot of heat and phlegm. And so it took a little while to get the phlegm out, though her shortness of breath is not an issue or less of an issue now. And directly from email, not solicited from the patient, sent to me, this is a direct quote. Quote, I feel a huge shift. Energy is much improved and I'm overall feeling close to my old self. I feel as if I'm living through a medical miracle. Thank you. Thank you does not begin to express my gratitude. That's the kind of healing that is possible. And I think that's the kind of healing we can aspire to. But what allows us to treat at that level are these traditions, right? Where we're trying to understand the past, the present, and the future. Shan Han Lun allows us to understand that. Wen Bing allows us to understand that. The Wai Kun neurological tradition allows us to understand that. And Pian Hua allows us to understand that. So with that understanding, we can treat where something is currently, which we could say is a Zhang Fu diagnosis, where something came from and where something is going. And all of those changes corresponded to what I anticipated in the pulse. There was less heat, there was less damp, there was less wind. And she just felt a whole lot better. And she continues to come in because now we're treating the long-term effects of the COPD and the Lyme disease, which the diagnosis goes back more than 30 years. So she's coming for treatment. Not everything has resolved, but the COVID and the long COVID things have resolved. And so now we're continuing to treat the other stuff. Okay, that's what I got. Very happy to answer any questions. I know there were some questions coming through that I may not have seen. So if you have any big or small questions, happy to answer them. And if folks want to continue this discussion on Friday, September 20th, I would love to do that as well.
Oh, is it Friday? Let's make
Oh,
sure
I'm
it's
sorry,
Friday.
Saturday. Sorry.
Saturday. Yeah. Okay.
Saturday, September 20.
Okay. And don't
Okay.
you have a Lyme class on Net of Knowledge? Isn't your Lyme class on Net of Knowledge?
The Lyme class is not on Net of Knowledge. There's a bunch of other
Oh,
classes on Net of Knowledge. There's the
oh,
neurology tradition is on Net of Knowledge. There's inflammation and climate change class on Net of Knowledge. There's one on COVID and climate change and Net of Knowledge. So if you go to Net of Knowledge, there's a bunch of class. Oh, there's a good class, if I do say so myself, on phlegm. Because there's 7 different kinds of phlegm. And so to get good at treating phlegm, you have to get good at treating hot and cold and damp and dry. So there are classes on there, not the Lyme class yet. I'd love to do a Lyme class. Maybe I can do that at the next Florida Acupuncture
oh,
Conference.
actually, we did one. So I think I have one maybe on the Fosoma site. If,
Oh,
uh,
oh yeah.
yeah,
Yeah. From years ago, I taught at the Pasoma. Yeah.
yeah,
When there's
yeah.
not on Net of Knowledge yet. Maybe it could get Net of Knowledge. Okay, here's a good question. An analogy between COVID and infection, the difference between the two. Yeah, great. The more precise we can get in our language allows us to be more precise in the treatments. So someone was asking aggressive energy to clear in addition to IDs and ADs. So aggressive energy is a treatment that was reintroduced to the West by J.R. Wesley. I don't use aggressive energy treatments because I don't know what they are. I don't know what aggressive energy is, so I don't treat what I don't understand. I use a lot of internal dragon and external dragon treatments. Aggressive energy treatments are just very superficial, like sinew level needling, very superficial needling on the yin back shu points for the yin meridians. And so that clears things out. But I'm not sure what that is exactly. And I've asked a lot of people and I haven't gotten a clear answer. So, but do I think aggressive energy can be incorporated? Yes, I do. I don't incorporate it because I don't use aggressive energy. I use IDs, internal dragon treatments, and external dragon treatments, EDs, a whole lot, and those are transformational. And as I mentioned, I also use a lot of different ghost points, including Sun Tzu Miao's ghost points. Okay. Well, thank you. I appreciate the compliment. It's wonderful to have everyone online. And hopefully we continue the conversation on September 20. And if there's a way for us to continue the conversation on Net of Knowledge, I'm very, very happy to do that also. So I'd love, again, to provide a context. I don't think it's very likely that Western medicine is going to effectively treat this. And we can treat this. And this is probably the primary policy and economic issue in the West and maybe in the world now. So this is an opportunity for us to show what we can do, and we can do it. And honestly, there may not be anyone else who can do it. It may not be like, oh, we'll just leave this to Western medicine. We'll leave it to other people to do it. There may be no one to treat it, right? We could be the ones. And so not only is that important medically, it could be important in terms of policy and in terms of healthcare economics. So we can do it, and let's do it. And there may not be any reinforcements coming in, right? We may be the ones to do this. And my clinical experience treating probably about 60 people to date is this is very, very achievable. Really, really achievable. So let's go out and do it. And if we can continue the conversation, I would love to continue the conversation. Okay, question to treat damp or phlegm except spleen 10. Oh yeah, there's lots of points to treat damp and phlegm. Well, I do have a class on Net of Knowledge about treating phlegm. And the reason I'm saying it that way, or spleen 9, yeah, the reason I'm saying it that way is because there's 7 different kinds of phlegm. So this is important because if you look at the points that are used in modern Chinese medicine and the herbs that are used in modern Chinese medicine, the herbs like bansha, pinellia, or hupo, magnolia, or fuling, poria, or baiju, atractylodes, they're assuming a particular kind of phlegm. They're assuming damp phlegm and cold damp phlegm. But damp phlegm and cold phlegm are only 2 of the 7 different kinds of phlegm. There's hot phlegm, there's wind phlegm, there's dry phlegm, there's insubstantial phlegm, there's fluid phlegm. There's 7 different kinds of phlegm. So the reason I bring that up is because depending on the kind of phlegm you have, or you're trying to treat, the points in the herbs are very different. Cold phlegm is not the same as hot phlegm, which is not the same as wind phlegm, which is not the same as dry phlegm. So you have to differentiate it. So once you differentiate it, then there's all kinds of points, all kinds of herbs, all kinds of formulas to treat it. So it's not as simple as we're just going to warm the stomach and the spleen. We're just going to transform the stomach and the spleen with acupuncture and herbs. There can be points that clear heat can clear phlegm. Here's an important point. Points that tonify yin, herbs that tonify yin can treat phlegm. That would be dry phlegm. So dry phlegm is when you need bien hua, right? Heat creates dryness. Dryness creates dampness, which is phlegm. So sometimes the way to treat phlegm, you actually have to moisten the body. And that's really true. That's not just interesting theory. I see that very regularly where the phlegm, the pathological phlegm, the pathological fluids is coming from a lack of fluids. So you actually have to tonify yin. So yes, Pandora's box, yes. Yes, or just interesting ways of understanding what's going on. And where do I teach in North Carolina? I teach at Taoist Traditions. I actually just finished a doctorate degree there, and Taoist Traditions is based on the teachings of my teacher, Jeffrey Yuen. So I've been studying a lot over the last almost 20 years at Taoist Traditions, but I do teach there, and I'm going to start to teach there hopefully again in the spring. Okay, anything else? Where does the theory of the 7 phlegm come from? Well, I wouldn't say I made that up because I didn't make that up, but what I did is I compiled that from different sources. So I've never heard of anyone say it that directly. But if you look, so I took that from my teacher, Jeffrey Yuen, his teachings. I took it from reading that I've done in Bensky. Bensky, if you look in the section on phlegm, they don't say it this way, but they are describing the 7 different kinds of phlegm. And the 7 different kinds of phlegm, the Wu Jing model, the 5-element, the 5-phase model is really brilliant. And so the 5 different climactic influences, right? There's cold, which is the water. There's wind, which is the wood. There's heat, which is the fire. There's damp, which is the earth. And there's dryness, which is the metal. All of those have phlegm. So there's cold phlegm, which is the water. There's wind phlegm, which is wood. There's hot phlegm, which is fire. There's damp phlegm, which is earth. And there's dry phlegm, which is metal. So that's the 5 starting of the 5 phlegms. But then there's also insubstantial phlegm, which if you look at the points and the herbs for insubstantial phlegm, that's actually like the idea of phlegm misting the mind. It's the heat rising up to the chest and affecting the heart and the orifices. So that's hot phlegm, kind of progressive hot phlegm. And then the 7th phlegm is what's called fluid phlegm. And fluid phlegm is when the phlegm originates in the abdomen, which we can say is maybe damp phlegm, because that's earth, stomach, spleen. And then the damp phlegm descends, because yin descends from the middle burner to the lower burner. And then the phlegm is affecting the yuan qi, the source qi. So it's affecting the qi from the kidney. So we can say that that's, again, kind of water-based phlegm because it's affecting the yuan qi. But if you go to the 5 elements, the climactic influences the 5 elements, they can all have phlegm. And then there's one that's the phlegm goes up, mists the mind, insubstantial phlegm, which is fire. And then another one where the phlegm goes down and affects the water, affects the kidney. Okay, is it possible to destabilize a weak patient with internal dragons? Yes, certainly. So strong treatments, it has to be the right time. Most of the time with really strong treatments like internal dragons, external dragons, or ghost points, Sun Si Miao and lots of other people have ghost points. Yeah, someone has to be strong enough to clear things out. They have to know qi and yang, enough resources to clear things out. But also there needs to be enough rapport, enough safety, because those are strong, right? Really, really strong. So a lot of times I'll clear things out on not such a deep level, and then make sure someone's strong enough before I do those treatments. So yes, you can destabilize people with strong treatments. Okay, and just someone's listing different types of phlegm. Okay, yeah. And I have a phlegm course on Net of Knowledge that was I taught at the Florida Acupuncture conference that then got listed on Net of Knowledge, and I talked specifically about acupuncture and herbs and diet and lifestyle for the 7 different kinds of phlegm. Okay, anything else? Cool. I agree. Chinese medicine is profoundly cool on all levels and interesting and really clinically effective. Happy to help. Look forward to continuing the conversation.
Okay, well, we really appreciate this. Boy, learned so much just in this one little hour. I'm looking forward to your Saturday class. So if anybody has questions for me, uh, I'll put my email in the chat, director@fsoma.org, and we will see you all on hopefully on Saturday the 20th. Remember, long COVID 10 is a code to save you 10% on the class. And we'll talk to you all later. Thank you. Thank you so much, Brendan.
You're welcome.
Right.
My pleasure.
Right. There are a lot of hearts floating up. I don't know if you see them.
I did. Thank you for the
All
hearts.
right.
I appreciate them.